So I'm going to be speaking to you today about the schizophrenia. So the schizophrenia is the thinking disorder, right? So psychotic thinking behavioral problem, especially the fragmentation pattern of thinking. Let me read it. Schizophrenia is a group of mental disorder characterized by psychotic feature. What are the psychotic feature? Maybe patient has a hallucination and delusion. Hallucination means false belief with the sensory component, like hearing or touching, smelling, or feelings. And delusion means the false belief in mind. Both are positive psychotic symptom. The disordered thought process. I said psychotic thinking or behavioral problem when more than 6 months, or some books said fragmented pattern of thinking. The patient who diagnosed by schizophrenia, the functioning and relationship significantly impaired. So they said disrupt the interpersonal relationship or disturbance in affect, mood, behavior, and thought process occur. So treatment with medication control the symptom associated with disorder. Hmm? So what are the signs symptom or data collection? Physical characteristics. They said maybe the patient is neglect the hygiene, eating disorder, sleeping disorder, or disorder in elimination, bowel elimination, or bladder elimination. So the patient who diagnosed schizophrenia, they cannot tell the difference between real and unreal. They do not distinguish between real and unreal. And this is the disease is a chronic mental disorder. And the patient need lifelong treatment. Okay. So body image distortion and maybe preoccupied with somatic complaint. We categorized the schizophrenia sign and symptom like positive, negative, and cognitive. The psychotic disorder patient present with a lot of symptom, and different patient has a different symptom. It does not necessarily every patient have to have all of the sign and symptom what we wrote here. We categorized the sign symptom positive, negative, and cognitive. What is positive sign? Positive signs are the presence of thinking not normally present, like hallucination, delusion, or in its motor abnormal behavior, or even speech alteration or hesitation. Let me read it. First one, they said psychotic positive symptom are delusion. And I said delusion, which means a false fixed belief. Delusion has some type like delusion of control. I'm thinking somebody control me by giving do that, do this, or delusion of reference. Hmm? Hallucination means sensory perception, but is no stimulus. They said sensation, but not there no physiological cause. And there are several types of hallucination. Okay. So what next? Disorganized speech. What salad? Or disorganized behavior means bizarre type of behavior, or bizarre no or without purpose, or catatonic behavior. Let me recap it. So disorganized speech, we called what salad, means disconnected. What they're talking, each and one is not connected, disorganized thought, and using recognizable words that do not make any sense. Sometimes fight of ideas, or some patient present with neologism or echolalia. So they made up the word that only the patient can understand, or patient repeat what you tell them, they can repeat it accurately. What is said to him or her, we call echolalia. And bizarre or no purposeful. So you see, this is the first picture. Patient can sitting like this for a long time, and this is totally purposeless. And this patient has the, you see the body posture, hand movement, they can be this position for a long time, or also the picture look like this, abnormal bizarre posture. And catatonic behavior means a state of stupor or unresponsiveness in a person, or inability to move normally. We call catatonic behavior. Negative symptom. So removal of normal process, decrease the emotion, loss of interest, flat affect, inappropriate response. So you tell something good, but their expression is totally opposite. Or elosia means the poverty of speech is a negative symptom. Or evolution means decrease the motivation. If I summarize the negative symptoms are absence of things that are normally present, like affect, we called flat affect, or elogia. Elogia means decrease the thoughts or decrease the speech, lack of energy, lack of pleasure, lack of motivation. It is called evolution. all is negative sign. Other sign are cognitive sign, affect the memory, learning process, understanding procedure, and also difficult to notify. So other sign symptom, disordered thinking, poor problem solving abilities, or difficult to concentrating, memory issue, patient feel hopelessness, or very late stage suicidal ideation, even depersonalization means loss of identity, or derealization means perception that environment has changed. So here in this next picture, here they said when we diagnose the schizophrenia, this is the major sign: delusion, hallucination, disorganized speech, disorganized or catatonic behavior, and negative symptom. So patient at least two positive symptoms have to diagnose the schizophrenia, or any one positive symptom and two or more negative symptoms should be there. And also the sign symptom or psychotic thinking or behavior lasting for more than 6 months. Also, patient do not any other condition like substance abuse. Then we can diagnose my patient have the suffering by schizophrenia. What next? Next here, they said, let me read it. Motor sign symptom like catatonic posture, holding bizarre posture for a long time. This is catatonic. Catatonic excitement, moving excitedly with no environmental stimuli. Possible total immobilization sometime, inability to respond to comments, repeated or stereotype movement. So what you tell, they repeat it. And also they said elevated by agitation, inability to speech, loss of inability to sleep, loss of appetite, and also loss of weight. Inability to initiate the activities. What next? Emotional character. The patient who diagnosed schizophrenia, it is very difficult to make them trust. They do not depend on someone. So mistrust may be present. So when as a RN, when you work with them, it is very important to make a trustable relationship. View the view of the world as threatened and unsafe. Affect may be blunt, flat, inappropriate, or may display feelings of helplessness, anxiety, anger, also feeling guilty, or depression in response to hallucination or delusion. Another term we have to know beside of hallucination and delusion is called illusion. Illusion means misperception of a stimuli. And compulsive rituals perform as an attempt to solve the conflicting feelings. And over-compliance, attempt to deny the responsibilities for any action by doing only what others instruct accurately. So, what are the other sign symptoms? Affective disturbance and abnormal thought process. Flat or inappropriate affect, altered thought processes, impaired the reality of testing, fragmentation of thought or thought blocking, loss of association. Sometimes we called fight of ideas. Each sentence related to the different topic, and listener is unable to follow the patient's thought. And also echolalia. Echolalia means the patient repeat accurately what is said to him or her. Distorted perception and neologism means made up the word that only the patient understand, nobody understand. And also musical thinking. What next? Abnormal thought process. Here, inability to conceptual meaning or inability to recognize the fact logically. Delusion associated with thought process. And delusion means a false fixed belief, a false belief in mind, no relationship with reality. And they categorize the type of delusion like loss of references, delusion of persecution, delusion of grandeur, and somatic delusion. So loss of reference, in which the client believes that certain events or situation or interaction are related directly to self. So like they're watching the TV, and in the TV broadcasting the weather report, they thought this message only for them. Delusion of persecution means in which the client believes that he or she is being hassled or under threat. So I'm thinking my friend putting some poison in my food. Also, the delusion of grandeur, in which the client attaches the special significance to the self. Imagine the patient thought, I'm talking to the God, and God talked to me. I am the superior than others. Somatic delusion, in which the client believes that his or her body is changing and responding to an unusual way, which has no basis in reality. So because of this abnormal belief, abnormal or misperception, we never ever go for argue with them. Then perceptual distortion, illusion that may be brief experience with a misinterpretation or misperception of reality. What is illusion? It is the misperception of stimuli. Hallucination. There are 5 types of hallucination, such as sensory, imaginary, auditory, visual, olfactory, gustatory, and tactile. So I said sensory perception that do not have any external stimuli, right? Like auditory, patient hear a voice or sound and comment hallucination. Voice instruct the patient to perform the action at the risk to hurt self or others. Auditory, somebody telling something, do this, do that, and they go to follow that. Visual means patients see the person or things, but others do not see. Olfactory means patients smell some water, but others do not. Then gustatory, patient experience the taste. Or tactile means patient feel a body sensation. Next here, the language and communication disturbance. Related to disorder in thought process, inability to recognize the language, difficult to communicate clearly, inappropriate response to a stimuli as well. Because patient always, jumping one subject to other subject. And also what they said, it is difficult to understand. And we call the word salad or fight of ideas. Inappropriate response to stimuli, we call flat affect. A single word or phrase that may present the whole meaning of the conversation such that the client may feel that he or she has communicated adequately. And also developed a private language, what they only understand. And they always talk meaningless way. So now go, what are the intervention for psychotic disorder like schizophrenia, or what are the nursing care? So we always provide the safety or structure environment and attempt to identify and reduce the symptom trigger. So what are the underlying cause? Increase the sign and symptom, just try to remove it. Decrease the environmental stimuli and also give the priority to the patient. We ask the patient directly about hallucination, including comments or what they see. Comments hallucination is very important to find out. Provide for safety for the patient and others. And one-to-one observation is very important. And we do not argue or agree with hallucination or delusion. Example, if patients say, like I said, patients say, I can see the God in front of me. You should reply, I do not see or I don't hear anything, but it must be scary to hear the voice. Let me read it. So monitor the hallucination clue, intervene with one-to-one contact. So one-to-one observation is very important because patient is very harmful to them or others, or suicidal ideation. Dictate the stimuli or move to the client to another area. Avoid conveying to the client that others are also experienced. Respond to anything real that the client talk about. Avoid the touching the client, encouraging the client to express their feelings. What next? If patient are active hallucination, right? So during a hallucination, attempt to engage the client attention through a constant activity. Accept and do not joke about the patient or client behavior. We do not do it because they have a mistrust. Provide easy activities and structure environment. Monitor for the sign of increase the fear, anxiety, and agitation. Decrease the stimuli as needed and mean medication as prescribed. Usually conventional medication or atypical antipsychotic is very effective to treat the schizophrenia. So also for the client with hallucination safety, the first priorities. Next, if patient have a delusion, interact based on reality or encouraging the client to express their feelings or initiate the activity one-to-one basis or alter the hospital routine as necessary, recognize accomplishment and provide positive feedback for the success. So that is more than enough for psychotic disorder for NCLEX board exam.